Hello, I'm Katya Adler from the BBC World Service. This is the global story. Measles is one of the most contagious infectious diseases. It's also one of the most preventable. But measles cases around the world nearly doubled last year. They're still rising. And the number of countries with large disruptive outbreaks has tripled in the last few years. So today we're asking, why is measles back? And how dangerous could it be? With me today is BBC Health correspondent Smitha Mundasad. Smitha, hello.
Hello.
Your health credentials, they're full on, right? Because you were a doctor before you became a journalist.
I was, yes. I worked as a children's doctor and then I joined the BBC and I've been in the health team for quite a while, so health is my thing.
Why move from being a doctor? My family's, my in-laws, riddled with doctors. They're very passionate. And I don't think, hard as I try to bring them over to my profession, that they'd budge.
Everyone asks that. I think the shortest answer is medicine was a bit of a family tradition in my family too. And let's just say I was strongly persuaded that it was a good idea to do it, but I'd always had my heart set on news. And so I'd always made this deal with my parents that I would do the degree, work for a while, and then do what I want to do and see which one I prefer. So that's what I did.
Today we're talking about measles. Why do you feel strongly that we should be talking about measles, worldwide at the moment?
It is making a comeback. And there are parts of the world where the cases of measles are going up and up. And it's not just this sort of benign childhood disease. It can cause really serious problems. 1 in 15 children here in the UK go on to get complications. That could be as simple as an ear infection, but actually it can also lead to deafness. It could be that it goes to your lungs and you get pneumonia, but 1 in 1,000 or 1 in 2,000 get something called encephalitis, and that is swelling of the brain, and that can lead to, permanent brain damage. 1 in about 5,000 cases here in the UK actually die. Now, in other parts of the world, it could be 1 in 100 who die.
And then there's the other aspect of it. Again, I suppose we've all forgotten because we don't remember measles being something that we need to worry about. And we've just learnt this with COVID, that you can apparently recover from one illness, but it just leaves you that much more vulnerable to others.
Vaccines, in a way, they've been a victim of their own success because everyone goes off and gets their vaccines. And for years, we don't really see much of a disease. We don't see people with polio so much anymore here in the UK and many countries. We haven't seen many people getting these complications of measles. But you picked up on something that is quite scary, really, that there's been more and more evidence recently that measles can do this thing where it can kind of cause an immune amnesia. That is, that it can kind of wipe out your body's memory of how to fight diseases for some time. So it's not just the measles, it's the other things it can do to your body that we've got to think about.
And we're talking about childhood illnesses, so we associate it with children.
It does mostly affect children, under 10s, under 5s mostly, but it also can affect adults and young adults. At the moment, there's a catch-up campaign in the UK saying young adults that missed out on your vaccine, get your vaccine now. And it can cause serious consequences for adults too.
I ended up with measles into my lungs, so I had to go into oxygen because it affected my saturations. It was similar to pneumonia that I ended up with. So COVID I was hospitalised with for 3 weeks, and I was really unwell with that. If you compare COVID to measles, it made COVID look like a mild cold. Measles was an unreal illness and I wouldn't wish it on my worst enemy personally.
That's a very clear example of what measles can do to you as an adult. And there are other considerations adults need to take as well, because if you're pregnant and you catch measles, it can be devastating. It can lead to miscarriages, babies can be born premature, lower birth weight, and there can be serious consequences for the mum as well.
We should just really underline that this disease is hugely infectious.
If you were to put a person with measles in a room with 10 people who weren't vaccinated and shut the door, you would get 9 of them infected with measles. It's an airborne virus. That is, that it is spread through the air. When someone coughs, someone sneezes, even someone breathes who's infected with measles, someone could get it. And that virus, it stays in the air, infectious, for 2 hours or so, and even on surfaces for 2 hours or so. So we are talking about a very contagious virus that is very, very easy to pick up if you haven't had the vaccine.
Now I'd like to ask you where we see these increasing cases of measles.
Perhaps the noise is loudest about measles in countries where it's not endemic. That is to say that it is not sort of part of the fabric of the normal conditions that are passed around in the country at the time. And so many people will be hearing about cases going up in countries like the UK, the United States, parts of Europe.
And then the others, I think, so that's where it wasn't endemic.
Measles is more common in parts of the world where healthcare facilities have been disrupted. Conflict, war, where there isn't the money for there to be really good healthcare facilities. It's more common in some parts of Southeast Asia, Sub-Saharan Africa, places like Yemen, places like Ethiopia, where there's a lot of pastoral communities that move around, and it can be harder to make sure that they get the vaccine. And with protracted conflict, it gets harder for people to get the vaccine. Places like Afghanistan, for similar reasons, have been seeing high numbers of cases. You know, in these countries, we're talking about 12,000 to 20,000 cases.
I mean, I understand about 45% of measles outbreaks are in these sort of more fragile countries, if you like. But then would you call those outbreaks, and I say this very much in inverted commas, normal?
No one wants to see it as normal that there are cases of things like measles in parts of the world where there is conflict, where there are groups of people living in camps, for example, who've been displaced. It is the sad reality that when health centres, etc., are disrupted, then these kind of diseases do come back. So to an extent, it's a horrible reality that does happen, that you do see these kind of diseases coming back in countries where there are natural disasters and man-made ones too. But on top of that, we are seeing kind of this global pattern where actually vaccines aren't getting to everyone, and measles is going up in many countries. There's been a real effort for the vaccine to get to people. And over the last 20 years, the vaccine rates have been improving and the deaths from measles have gone down a lot. But actually, there are other things at play here. So yes, when conflict arises, of course, this disrupts things. There's also the pandemic. That has obviously diverted resources, the COVID pandemic. So in some of these countries, they've had to make decisions where, the routine vaccines aren't being given because actually all the money went into sort of all the COVID measures.
How many people are we seeing measles affect worldwide? Can you say that? Or do we have sort of global comparisons now and 5 or 10 years ago, for example?
The World Health Organization is really concerned at the moment. It says that no region in the world is free of measles and is fully protected from measles.
In 2022, there were 136,000 children who lost their lives from measles, a completely preventable disease. And there were over 9 million cases around the world. We know that last year, the number of cases went up by about 70%, and we're still working on the data around how many deaths likely occurred last year.
So what is happening now with the vaccine? Is it as clear as that vaccination rates are going down globally for different reasons, and that is why? Is the equation that simple? It's all to do with vaccine rates?
The equation is that simple. We have a vaccine that is highly, highly protective against measles, but what we have seen globally is that the rate of vaccination has gone down in the last few years. There's this thing called herd immunity or community immunity, and basically it's kind of the number of people in a population that need to have had that vaccine, so that if someone gets measles and someone else is unvaccinated as well, that that they can't pass it on. It becomes harder to pass it on if you've got loads of vaccinated people. Now, the number that you need to protect the community from measles is 95% of the population needs to have had their 2 measles vaccines in order to create that herd immunity. So people who can't have the vaccine, maybe because they've got some other illness that means they're not allowed to get the vaccine, then they're protected too. Now, the problem is that in the world right now, about 83% of children have had 1 dose of measles vaccine. You need 95% of children to have had 2 doses of measles vaccine in order for measles not to be easily passed around. Partly that's because the COVID pandemic meant that resources, money, doctors, nurses, health centres, they had to prioritise COVID. They had to go elsewhere. And so routine vaccinations that infants would have got were not prioritised. In some places, people were worried about taking their kids, even if the vaccines did continue. They were worried about taking their kids to health centres full of people during COVID, for example. In some cases, they just didn't happen at all. So there's the disruption to healthcare that the pandemic caused that meant that some people just didn't get their vaccines. But then there's not just that. There's also, I think that there's sort of a vaccine fatigue, that people heard so much about vaccines during the COVID pandemic that many people were concerned about getting a new vaccine, the COVID vaccine, that some of this, experts are saying, has kind of spilt over to other childhood vaccines. And people are either just very tired of vaccines, some people, or they actually got a bit concerned about the notion of vaccination because of some of the misinformation they heard about the COVID vaccine.
A lot of mistrust and distrust, and again, often fueled on social media.
And this isn't even new to the pandemic. Even before the pandemic in 2019, where there was a large measles outbreak, experts were really worried about this idea of mistrust and misinformation on social media. And of course, it can spread very, very quickly.
It dates back sort of even pre-mass social media, doesn't it?
In 1998, you're referring here to the completely discredited, debunked research that was published in the Lancet Medical Journal by a doctor called Andrew Wakefield, who has been struck off the medical register in the UK. And he did this study on 12 children and suggested that there could be this link between the MMR vaccine and autism. Now, this has been proven in subsequent many, many studies that there isn't this link. It's completely debunked. But yes, a seed was sown of mistrust, of worry, that of course, parents facing that kind of information, of course they're going to be worried.
We were having a group discussion amongst the team here at The Global Story, and one of our producers, Alice, was saying she'd had to vaccinate her son, and the rates that she'd gone to, she believes in getting a vaccine, but she had to take time off work to do it. She had to take him out of his nursery to do it. And it was all quite complicated. And in the times of, cost of living crisis in many countries across Europe, for example, I mean, here in Europe, you could imagine that parents would say, I can't risk taking time off work to do this. It's not the top of my priority list. Is that what you're also seeing?
I think you've hit the nail on the head there. I think that there are many people for which it is really difficult to get that vaccine. It's hard to take time off work. You can't afford to take time off work. It's hard to know where to get the vaccine, when to get it. There are so many childhood vaccines that it could be hard to know when you're supposed to get it. If you've got many children and you're trying to juggle the different vaccines, that's also really difficult. Parents, right? I am a parent. I have 2 young children. Parenting is an amazing but overwhelming job where you've got to juggle so many things. You want the best for your child, but actually making sure you get those vaccines. Yes, for someone who is struggling to feed their children and struggling to keep a job going, it can be really hard to make that time to go and do it. And so it's the idea that it should be easier to get them. It is different in countries where there is war, where there is conflict, where there is natural disaster, where it is not easy to get your vaccines, even if you're reminded about them, even, there are such difficulties and the infrastructure isn't there for the vaccines. But the World Health Organization is clear that until the measles vaccine is available easily, even in those places, then nowhere is going to be safe from measles.
The main reason that children don't receive measles vaccine has to do with the ability for them to access vaccine, the ability of programs to get to all of the places in the world, to every child, everywhere, in every village, every city, every place where a child is, in order to vaccinate them. And that's an ambition that is humanly possible.
What can be done to stop the trend, would you say, Smitha?
Look, I'm conscious that I've given a lot of solutions that would work here in the UK, in the US, in parts of Europe where they've got money to throw at these situations. But there's actually some really good innovation going on right now. There's a trial in the Gambia that's looking at it's a little sticking plaster type patch that has microneedles in it. They're not painful, and they deliver the vaccine just in this patch. And it's been shown so far to be effective in the 200 children that they've tried it on. So if this could work, then it could mean that you don't need fridges, for example, to store the vaccine. You might not need trained healthcare professionals or as many trained healthcare professionals to deliver the vaccine. So these kinds of innovations could be key.
Because vaccine equity across the world is so important, is it?
You're absolutely right. The pandemic made it very clear. It's a message that lots of global health experts have been saying for years before that look, diseases, viruses, they do not respect borders. They don't care how rich you are. They don't care about any of that. What you need is to make sure that everyone gets the vaccine. Everyone has good healthcare. That is the way to keep everyone in the world safe. And I think one thing to remember about measles is that it is so infectious that it's often the first pathogen to get past a population's defences. It's kind of a bellwether thing where actually, if you've got measles into a population, then it shows that your vaccine rates for other things are probably not as good either. And that you might then get whooping cough, for example. We're seeing cases rise here in the UK. The vaccine rates have been falling, not just for measles. So it's an alarm bell, actually, that maybe people need to make sure around the world that countries' governments prioritise childhood vaccination.
Smitha, thank you so much for your time and your passion.
Pleasure.
And thank you for watching. If you want to hear more Global Story episodes, you can find us wherever you get your podcasts. And don't forget to subscribe so you never miss an episode, and leave us a review. As for today's episode, please leave us your thoughts in the comments below. Goodbye.